Welcome to this explainer. If you've been dealing with a stubborn, aching, or just plain burning stomach lately, I want you to go ahead and pull up a chair, take a deep breath, and seriously, just relax. You are in exactly the right place. Today, we're going to walk through the exact evidence-based steps that doctors use to evaluate and treat stomach discomfort. My goal today is to literally sit down with you, kind of like we would in a clinic, and explain this whole diagnostic process simply and clearly. By the time we finish up, you'll understand exactly how we figure out what's going on in your gut.
It's incredibly natural to feel anxious when your stomach hurts for no clear reason. When we experience pain day after day, our minds kind of tend to wander to the absolute worst case scenarios, right? But I want to offer you a really comforting roadmap right out of the gate here. Stomach complaints are actually among the most common issues we see in outpatient gastroenterology. In the vast majority of cases, we're dealing with benign, highly treatable conditions. So today, we're going to look at the exact step-by-step algorithm doctors use to sort this out. We're going to figure this whole thing out together. So let's jump into section 1, decoding your discomfort, or translating medical terms into what you actually feel. Now, what's really interesting about this slide is how the medical world is pretty famous for using scary-sounding jargon to describe totally normal feelings. Let's decode that discomfort a bit. When doctors say dyspepsia, they're really just talking about general stomach pain, or that burning feeling right in the middle of your upper abdomen. Postprandial fullness, that's simply that uncomfortable sensation of feeling overly full or heavy after eating just a few bites. Early satiety means you sit down hungry, but, well, you get full way too quickly. And bloating, we've all been there, it's that tight, stretched balloon feeling in your belly. The challenge for your doctor isn't naming these feelings, it's distinguishing simple indigestion from something that requires a bit more attention. Moving on to section 2, the fork in the road. This is all about how your age helps us choose the safest path. To make that safe distinction, modern medicine uses a really specific step-by-step algorithm, and it actually starts with one very helpful number, which is 55. According to the latest clinical guidelines, 55 years of age is the threshold doctors use to safely guide our diagnostic decisions. Basically, your age immediately tells us which branch of the pathway we should walk down first. Here's how that plays out in real life. Let's say you're a 34-year-old with months of stomach burning and feeling full after meals. Because you're under 55, you fall right into the younger, low-risk pathway. This means we completely avoid unnecessary invasive procedures right away. We start with a gentle, non-invasive path. However, if you're 55 or older, say a 62-year-old presenting with those exact same symptoms, we take a quicker, deeper look right off the bat, just to be absolutely safe and to definitively rule out things like gastric or pancreatic issues. Age is simply our safest preliminary guide. Next up is section 3, spotting warning signs. These are the red flags that tell us to take a deeper look. Okay, let's dive into this. And before you worry, please remember we use these signs just to ensure we're being as thorough as absolutely possible. These are the red flags we rapidly screen for: unintentional weight loss, signs of anemia or low iron on your blood work, trouble swallowing food, frequent or severe vomiting, or any signs of bleeding. Now, I want to be very clear here. Having one of these is actually a poor predictor of something serious like a malignancy. Seriously, do not panic. It simply means that we skip the simple initial tests and go ahead and order further hospital checks, like a CT scan or a direct internal look, just to be incredibly thorough and safe. So if you do have those alarm features, or if you're over that age threshold of 55, that deeper look usually involves an endoscopy. This is a very routine, super safe procedure. We basically use a tiny camera to take a direct look inside your stomach. It gives us a definitive structural assessment, allowing us to see exactly what's going on in there, whether that's a peptic ulcer, some inflammation we call gastritis, or anything else. It just gives us total clarity.
All right, section 4, checking for the stomach bug. We're going to look at simple, painless ways to find H. pylori. But what if you're under 55 and have zero warning signs? Well, we skip the endoscopy completely. Instead, we pivot to checking for a super common, easily treatable stomach bug called H. pylori. And this brilliantly illustrates the beauty of gentle diagnostics. Step 1, you provide a simple, entirely painless breath or stool sample. Step 2, our lab checks that sample for active bugs. And step 3, if it's positive, we know exactly what's causing your discomfort and we start targeted treatment. This entire process keeps you comfortably out of the hospital. Let's move to section 5 and see how this builds healing and relief. These are the medications that actually calm your stomach. Once we get your test results back, we move straight into healing. The absolute cornerstone of treating this discomfort is a class of medications called PPIs, or proton pump inhibitors. I like to think of a PPI as a daily shield for your stomach. It dramatically reduces the amount of acid your stomach produces, which gives your sensitive, irritated stomach lining the critical break it desperately needs to repair and heal itself. They are incredibly effective as our go-to first-line treatment. Now, if your non-invasive test came back positive for that H. pylori bug we mentioned earlier, your treatment's going to look slightly different. We'll put you on a 14-day bismuth quadruple therapy. This is a very specific combination of medications and antibiotics. We use this exact quadruple therapy nowadays because the bug has actually grown kind of resistant to some older antibiotics like clarithromycin. So this 14-day regimen is our highly reliable, preferred method to clear the infection out completely, which usually resolves the stomach pain right along with it. Occasionally, patients have what we call refractory disease, meaning the burning and pain are just stubborn and linger even after standard treatments. In these cases, we might carefully introduce TCAs, or tricyclic antidepressants. Now, don't let the name confuse you. We aren't using them here for depression. In very low doses, TCAs act as highly effective gut-brain neuromodulators. They basically soothe and quiet down the overly sensitive nerves in your stomach, acting as gut-brain calmers to finally get you some relief. So the crucial point to take away is this. When it comes to standard stomach pain, burning, and fullness, surgery is almost never the answer. In fact, clinical guidelines specifically warn surgeons not to operate for uncomplicated functional dyspepsia. We only ever consider surgery for extremely rare, confirmed complications like a mechanical obstruction. For the vast majority of patients, we rely entirely on these simple, non-invasive tests, a little bit of time, and the right medications. As we wrap up this explainer, I really want to leave you with this empowering thought. Knowing that your doctors have a safe, structured algorithm to figure out your stomach pain should bring you immense peace of mind. But here is the truly fascinating part. Because of the powerful two-way street of the gut-brain connection, simply lowering your anxiety about the pain can actually begin to physically soothe the nerves in your gut. Trust the process and trust the simple tests. It really begs the question, if calming your mind can heal your stomach, what else is your gut trying to tell your brain right now? Thank you so much for joining me, and hey, here's to a happier, calmer stomach.